Okay.
At about 7 minutes till 2. We're running a little bit late, but we're ready to get started. And first I'm going to ask Councilor Frankie Hargis to give the invocation, please.
Lord, we thank you for this day that you have blessed us with and for the opportunity to take care of the Cherokee people. Lord, I pray that you'll give us guidance and direction in this meeting and keep us focused and on task. In Jesus' name I pray. Amen.
Thank you. Ms. Shelley, will you call the roll, please?
Yes, ma'am. Janelle Fulbright.
Present.
Dick Lake.
Here.
Bill England.
Here.
Jack Baker.
Here.
Joe Bird.
Aye.
Julia Coates. Cody Fishinghop. Here. Meredith Fraley. Here. Don Garvin. Tana Glory Jordan. Frankie Hargis.
Present.
Chuck Huston Jr.
Here.
Lee Keener.
Aye.
Curtis Snell. David Wilson.
Here.
David Walking Stick. Kara Cowan Watts. Ani. We do have a quorum.
Thank you. The chair will entertain a motion for approval of the minutes.
Make a motion to be approved. Second.
All those in favor, let it be known by saying aye.
Aye.
All opposed, same sign. The minutes are approved. And I want to thank everybody for coming today, and I want to thank our healthcare professionals in advance for all the hard work that they have put in during this past month. And now we'll get started with our reports. The first is Claremore, Mr. George Values.
Good afternoon.
Good afternoon.
We sent our report in to you. It should be in your packet there. Our outpatient visits are up on the increase. Revenues are up over last year. You see down there on the bottom of the first page, we're still gaining about 700 new patients a month. We expect that to continue, if not increase. Also with your packet, Ms. Snell told me that you had requested the number of tribal employees. I think I'm saying that right. That visited the hospital there, who were self-insured by the tribe. Those employees we are not allowed to bill. And I think somebody had asked what type of impact that would make, and that's why that third page is in the packet. I had asked our engineers in Oklahoma City for a timeline on our MRI. I thought we were close enough to do that. I spoke with them this morning and I was told that we are not close enough to get a hard timeline for that yet. Are there any questions?
Councilor Watts?
Thank you, Madam Chair. Congratulations on the hiring of the orthopedic surgeon. Seems like implementing that as additional services. I know that'll help third-party billing and also the services to our constituents, so appreciate that. How is it? It looks like that the contract health services numbers have improved a little bit in terms of what you're able to do at an in-health service. So I'm curious, how is that possible, or is it just a fluke for this month, or?
No, we're actually, what we're doing is, we're on the backside, we're taking care of the business end of this. We send purchase orders out to facilities and vendors and contractors, and after a certain amount of time, those don't get cashed in, we go back and cancel those purchase orders and reuse that money. So that's what you're seeing here is a reuse of the money that had been obligated a year ago.
Okay. What happens, I know we had one, no names, but I know I had one constituent I was working with you on where we couldn't get the vendor to initiate the PO, but yet they were billing the individual.
I haven't heard.
that work out?
I think we ended up reissuing the purchase orders 2 more times and calling them, reiterating to them they needed to fill those out and send those in, and they would be paid. And I haven't heard any more from the constituent.
So would we reserve that money? I mean, how do we determine that we're able to free that up before we get into the constituent?
We won't even look at those. We're really conservative. We don't even start looking at those until.
One last question. Has Oklahoma City area, or maybe you and your staff determined how sequestration is going to impact our Indian Hospital?
We have got nothing from headquarters as to how it's going to affect our budgets.
Thank you very much, George. Thank you.
Thank you, Madam Chair.
Any other questions or comments? Okay, thank you.
I apologize, I have one.
Okay.
So, hey, I think I shared with you the Marshall report on the activity for the Marshal Service at Claremore Indian Hospital and the new agreement with U.S. Marshals. Does that reflect what you have as well?
Yes.
Okay, thank you. Thank you, Madam Chair.
Cherokee Nation Health Services. Thank you. Connie Davis, next.
Good afternoon.
Aye.
A few things to add, just an update more than anything. On the 15th of February, we hosted the Oklahoma State Department of Health and some liaisons that we have access there to give us an update on how the Affordable Care Act will impact the tribe specifically. And there's a packet that I distributed because I felt like this was one of the better packets of information. We received so much, and just kind of summarized it in a little better way to understand everything. And I won't read everything to you, but just to highlight a few things, that the Affordable Care Act did reauthorize the Indian Health Care Improvement Act, and there will be new federal funding for Indian health care starting 2014 through Medicaid expansion and health insurance exchanges. Now, we all know that in Oklahoma, the governor has not agreed to the funding from the federal government for Medicaid expansion. And just this past week, Dr. Grimm met with a Levitt group that the governor's working with, and I'll let him kind of give you a more update from that. So we're very involved in that, and we'll keep you apprised as we become apprised. A Medicaid expansion would be extended to 133% of people meeting federal poverty level, and that would mean more people would be eligible, including men, which traditionally it's children and some young women. What else? The good thing is that the Native Americans won't be penalized like other Americans for not having insurance because of our Indian health funding. We're considered covered with insurance. The dialysis center in Sallisaw, I'm told, is open for business today. I talked to Jerry Kaufman to verify that, and the first patient will be dialyzed on Friday. So there are staff in the building. He's personally seen them and talked to them, so hopefully that's moving finally. We'll keep you updated on that as well. In January, we signed a letter of request with NSU for entry into a provisional accreditation process for a physician assistant program. We're really excited about this opportunity, and if we're approved, that program would begin in 2016. The classroom setting will be in Muskogee at the NSU campus there, but the clinical rotation sites will be here. And we will help provide medical directorship for that program when it comes along. I got a nice report in our medical executive committee this past week. Colonoscopies have been behind with a waiting list as many as 1,200 people. And so I know Brian Hill and Dr. Nolan have worked hard trying to get those numbers down. And Dr. Popaloo, our surgery director, reported that we've gone from 1,200 patients waiting to less than 600 since October. So I really appreciate her helping us address that big concern and getting these patients processed in a timely manner. I sent an email on Friday, I believe, but if you haven't looked at your email, in January we had 29 provider vacancies. We also implemented our provider salary increase, and I'm very excited and happy to tell you that we now have 8 vacancies in that short time. There are no dental vacancies. Dr. Jones offered a letter of intent to the last dentist last week. I can't take credit for this. Dr. Montgomery has spent hours trying to work through all the caveats and the uniqueness of, there's so many things that are inconsistent in the contracts, but we're signing as quickly as we can get those things done, and the dental contracts have all been handed to the dentist. They're signed and they're back, and we're in the process of getting all the signatures on the rest of the providers, and they'll be distributed hopefully in the next week or two. If you get more questions from providers, concerns, and I know they're out there, have them contact us directly, because there's too many caveats to clearly address those. We're trying to meet with the providers. I met with some on Friday and clarify a lot of the misunderstandings there are surrounding the new contracts. But the good news is everyone's getting a raise and nobody's job's being cut.
Oh, that's really good.
In addition, we have 2 nurse practitioner interviews. So we're quickly approaching a position that we want to be in, where we have a waiting list for providers. I don't know that I have a place for these 2 nurse practitioners, but we're not going to turn them away. We're going to talk to them, and we're going to be planning. It's a good time. We've got budget planning coming up, so we're going to continue to, through our planning and the expansion of the clinics, identify where these people are needed and sign them up and be ready to place them as soon as we can. Also got another good report from Dr. Jones. I mentioned that he has staff going back and looking at our Medicaid billing denials for the past year. He now tells me that we can go back at least 2 years. And in the review from January 2012 to May 2012, they have uncovered $600,000 in uncollected charges. So that money should be coming to us as soon as they can get it processed. In the month of January, the emergency department saw 5,730 patients. We did have a left out being seen rate of 7.4. We want to be at 3%, but we opened up the urgent care at the same time. We put them on electronic health record, and it was a flu season, so we didn't do it very well. But all things considered, I think they pulled it off pretty good. We did 341 surgeries in January. Also, some more good news. The Comprehensive Care Agency, or our PACE program, has 121 patients. Their financials were audited the last week or two, and I got a report that there were no deficiencies found in that audit. Also, the Home Health and PACE program had their financial audit. There were no deficiencies reported in that. There was a recommendation that we had some separation of job duties as far as who pays the bills and processing of claims. I think we mentioned last month or the month before that Talcott City has 24-hour, 7-day-a-week cardiology call. And as a result of that, we have cut our cardiac transfers to Tulsa in half, which means patients aren't traveling 75, 80 miles, they're not out the expensive fuel or staying somewhere, lodging deals, and it's been a great service. Now, the really good things that I know people want to hear about is that this past Friday, the RFP for our J Clinic went out to bid. So we're moving. And I think Jack Brown's on the agenda, so I'll wait if you want for me to talk about that at that time. And then the other big thing I'd like to share, pictures. Ryan, do you want to come up and talk about the timeline? I'm not going to do well with glasses. This is our new Redbird Smith clinic.
This is Redbird.
This is Redbird.
Okay. Can you hold it up?
Yes. This is the east entrance, right? And it may be a little easier. Would you like for me to pass these around?
Is that what you want?
This is the current entrance right here. And then this part here will be the addition. And there'll also be an entrance on the back side to accommodate the parking and not have patients have to park back there and then walk all the way around to the other side of the building. We're pretty excited.
So since there's drawings now, does that mean there's square footage, number of patients served, scope of services, those kind of things?
There is some of that information.
This is Redbird.
Can you email that to us? Yes, okay. Yeah. Brian's gonna go over the schedule for Redbird for us.
We're working with Children's Architect. You'll notice on the drawings are the ones that have put these together for us. Right now, we've completed schematic design submittal. We're looking at March 26th for the design development submittal. May 7th, we will receive the 65% construction drawings. And at that point, they will turn in a bid package up to us that we will be able to bid out and basically allow us to start actually groundbreaking a lot earlier than expected. So, potentially looking at the groundbreaking the first or second week of June for the Redbird edition. So, we will get you the exact date as we get closer to that time.
The second week of June for Redbird.
Probably the first week.
They are Terrell certified chillers.
Yes, they are.
Yes.
Thank you, sir.
Go down. Counselor Lay, you're first on question.
Words of my thanks for bringing the dialysis center at Salisol. It's operating.
I had called Mr. Kaufman this morning and asked him to walk over and verify, and there are staff there, and they are open for business.
Is it Delco City or is it Vita or whatever?
They have a partnership that's called Flat Dialysis, is my understanding. I'm sorry. That's the name of the business they formed.
And they use Delco City and some other group?
And the that
Oh, Flat.
PLATT.
The vacancies, as I understand, talking, I think, Dr. Jones, that you count them filled when you sign them up, but they're not here yet physically.
Right. Some are and some are not.
And so when we get these phone calls from providers, you want us to have them call you? Have you guys seen all the providers yet?
No. No, we don't even have all the contracts signed because there's, what, 200 at least? And there's 2 copies of each, and it has to have my signature, go to Mr. Foster for signature, and then to the chief. So it's quite an undertaking, just to find time to sit down and write your name that many times.
We want to recapture, I think, I'm hearing 600,000 in dental that has not been paid to us, I guess. Is that what I'm hearing? And do we know how much in medical is out there that is owed to us we haven't gone to get yet?
No. We're gonna be looking though.
If it's 600,000 in dental, I see this big number churning around my head for medical.
We agree.
Thank you.
Okay. Counselor Walton-Stick, you're next.
The partnership with OU with, is it the LPN or RN program? Have we reestablished that yet?
You're talking about the contract for a clinical rotation site, and
Is that what it is?
well, I've received several emails from people I'm acquainted with, and then I think you and I have visited. But as far as I know, that was resolved in January so that they can begin their clinical site
That's what
rotations.
yeah.
Yes,
Okay.
it should be.
The other thing I was discussing, I was in the ER last Wednesday night, and anyways, I visited with the doctor over there, and I don't know if you had received my email or not, but it was, I heard you say that they've all received a raise, and he said that he had turned a letter of resignation in because of the competitive salaries around. And he said there was another doctor in the ER that was, potentially gonna, step down as well. And I know we've been talking about a shortage of doctors and how hard it is to recruit. And I just kind of want to know, I guess everyone needs to be aware, and I guess we are aware that the salaries are not competitive, but they're going to be competitive.
They are.
They are competitive as of now, as with the raises.
They are. We still have room to improve, but what we did was we proposed something that we could afford within this budget, not knowing what the impact of sequestration would be. And we're comfortable in implementing this salary adjustment, and we hope in 2 years that we can go back and do something more.
What is the adjustment in salary for doctors?
It's different for every specialty.
Okay.
But I checked with Dr. Franklin, the medical director of the emergency department, when I got a copy or word that we may be losing some ER providers, and that specific physician had already resigned for other reasons, and we're not losing anyone else.
We're not losing, it's just burner.
Yes,
Okay.
lots of them, good ones.
Sounds good. All right. Thank you, Chair.
Counselor Watts?
Thank you, Madam Chair. So, on your report, we talked about staffing and stuff. So, are we utilizing directed studies? Because I know on education, there was, I want to say less than 20 students. But are we doing, I've always wondered if we could do a better job with our education dollars for directed studies, because I noticed on some of your staffing that there were 1 or 2 candidates that were noted as directed studies candidates. We're filling those slots. Is there an opportunity to do more there? And if we have project funds, we should be allocating them to those areas to get those students through?
I think anytime we can invest in people, especially in the healthcare field, then we should take advantage of that, because we're dependent on them for our healthcare delivery in the future.
Has your staff sat down with the education staff to work through that and come back to us with that proposal, through whatever process you need in the chief's office? Because I think that's a missed opportunity, and I've struggled that we've been doing that since we created the Directed Studies program.
Now, Dr. Montgomery has worked some, but as far as a formal meeting, I have not formally met with the education.
I think that's an opportunity, because when I talk to the students, I talk about the community. I think the number one issue is our talented students is not, it's money, just being able to complete that. Especially if they want to come back and say our community are tied to us that way. Are we going, I noticed in your report, are we going to start doing sleep studies as a service, a healthcare service? I didn't understand what that was about.
We currently do those at Hastings, and the beds that are utilized are inpatient beds. And we don't feel like that's a good use of our beds, because that means patients are transferred if that bed's occupied or for a scheduled sleep study. In addition, we're 18 months waiting, so it's just not something we're doing very well, and the way we're reimbursed is not as well as if it was more of a business model. So we're looking at ways to maybe do that as a business.
Okay, so you'll continue to keep us updated on that? I think that has a lot to do with a lot of health issues that we see, so I'm interested in it. On your public health, thank you for inviting us to the public health Summit.
I forgot to put that on there. Thank you.
So, yeah, I mean, I was really excited to see the work that's being done by the staff. It's incredible. This is where we need to be in terms of comparative effectiveness research, where we're headed in healthcare. I think federal funding, especially that's tied to us, to the way we serve our people. The one thing, and I didn't get to attend everything, of course, but I needed to ask, are we doing baby-friendly hospitals and clinics as part of that effort? I mean, we just now got that, so I didn't see, is there going to be a lactation room in our new facilities?
Well, there is a lactation room in Bonita, I know that. We haven't, do you want to tell us?
Well, Hastings is going to need to be an issue. As far as putting something here, we are planning lactation in Hastings.
So we'll carry that theme throughout.
Thank you. So just to make sure, because we asked for the plan, and this was the first in terms of scope of services and size. So our goal is to have a lactation room and baby-friendly facilities and all those, the checklist that goes with baby-friendly to meet all those in both the hospitals and the clinics. Okay. And then one last thing, it came up in the newspaper, but we didn't know anything about it in terms of, and this has been some time ago under the Healthy Community Funds for the Cherokee Nation. Could I get an idea of what in the last 4 years has been done for Healthy Nation in terms of grants to the schools and the communities in Rogers and Tulsa County? Because we were caught off guard by something. It's been some time. It's not under the current.
There's a lot that they do, and I will have
Yeah, so if you could get us just a list of those for the past 4 years, it'd be helpful. Thank you.
Councilor Fraley, you're next.
What is the status on the pharmacy expansion? The trailer that they're working out of, the steps leading up to it?
in Salina.
Mm-hmm.
Chuck, you have to know that? Oh, Jeff, thank you.
We're in the final process now. We've got POs for the fixtures inside, and we're doing the POs for the robotics and all of that. It'll be about 6 to 8 weeks. We're hoping closer to 6 to get those fixtures installed and get them back.
And good. They're really squeezed
Yeah.
up in that little trailer.
I was by there on the way to Pryor and noticed that myself. They're starting to get dilapidated a little bit.
Appreciate it. I'll
Thank
pass
you.
it on.
Councilor Fisher-Hoff, you're next.
I was going to ask just two simple questions on them pictures. Is there any way to look at making the roof more like our colors, our building, the burgundy, the Cherokee rose color, instead of the red? If it's a possibility.
We're trying to match the existing annex roof right now. You can look at it, obviously it increases the budget quite a bit. We're trying to match the existing annex roof right now.
Okay.
Same.
Well, okay. Well, I was just thinking about making sure all the clinics look alike is what I was just focusing on. And the other thing is, Connie, I was going to tell you, thank you for meeting with the doctors down in Hastings. I got a text while I was sitting here Friday, and I was telling her from 3 other doctors that said they would talk to you, or 3 other providers, and said they really appreciate you talking to them one-on-one
We're happy
and
to do
getting a lot
that.
of the rumors settled.
We're happy to do that.
Okay, thank you very much.
Councilor Hargis.
I had someone asking about scheduling an event with Healthy Nations. Who would they contact?
Lisa Pivick.
Do you have any other questions, comments?
I want to commend your can I have a question? Commend your optometry department. I was there last week, went through the process, and waited about an hour and a half. But the facilities and accommodations and the attitude of the people was very professional. Didn't hear any complaints. I just sat there like the rest of them, read my paper, and put up with everybody's coughing and sneezing. But, it was good. I want you to commend your optometry staff. They did a really good job. A gentleman named Rusty, who will be losing, I think he's going back to somewhere in Lincoln, Nebraska, to go and practice with his father. Very good people. I want to commend you and your staff.
Thank you.
Yes.
Just one proposal to you to think about in the future, and this is probably more for Jeff back there. That perked you up, didn't it? Will we ever get to the point where we can have a drive-through pharmacy?
At Hastings,
Uh-huh.
in new building design, maybe. That was something that Connie and all of us would have to sit down on, because that would require major reconstruction. I think we'd have to lose the entire department.
Well, we're gonna be moving that entire department when we build our new hospital.
Right. Now, there's the
So,
opportunity right
Could
there.
absolutely,
we
I-
think about a drive-through pharmacy? And I don't know how we can accomplish this, but when we have 13 doors and we only have one that's open, it's a little disconcerting to the public. If we could maybe get more than one available pharmacist at a time, especially on like Friday afternoons. We know Friday afternoons are going to be super, super busy. Everybody just realized they're out of medicine. They can't make it through the weekend, so they all go on Friday afternoons. And I'm just as guilty. I go up there and I don't realize till Friday morning, I count my pills and I'm thinking, well, I'm not gonna have enough to get through the weekend, so you go up on Friday. But there's only one magic door that opens. If we could, and if I've heard, and they know you're on the council, so they all come and sit by you and say, well, why is there just one door when there's 13 of them? If we could do something on those busy times, if there's a way that I know we're spread thin on pharmacists right now, but if we could get more during those peak hours, I know it would be greatly appreciated by our constituents. And that's not meant to be a complaint, it's just meant for a thought in the future. I know we had a plan for the future, but that's what they call it. There's a magic door there, it's number 4.
I remember that.
Price is right, isn't it?
Yeah. And they're all watching that door, but they're all saying, well, isn't there somebody else behind these other doors? If you could help us out on those peak hours, I think it would really be appreciated by the folks that are utilizing our facility. Thank you.
I think that's at every facility. There's only one door.
Is there a magic door everywhere?
Okay. Counselor Light?
Just a quick one, this is Tyna's fault, yeah, she called out your name.
Oh.
Whatever happened to the 90-day prescription?
You can't help yourself, can you?
There is a process now that is finalized almost, and we're getting very close to implementing that. I think we're in the final stages. And I don't have a definitive timeline other than I'll say it's soon. But there has been a defined process now to help care for patients here in the United States. And when we get this done, I think it will prove to be beneficial to everybody. Well, I think we found roadwork finally in that. But Dr. McGovern may have more to say on that. I don't want to steal his thunder either. He was definitely a big player in this as well. In his articulation, I think we've come to a consensus.
Well, thank you, and who found the roadmap, by the way?
Dr. McGovern.
Okay, thank you.
It's a nomination.
Have we made any progress with the vision? I talked to you about the, how they charge you more if you have insurance.
We are making progress on that, and it's a little bit convoluted to try and explain because I have a hard time when I do have time to sit down and read. That we will be meeting we've asked for the contract that basically is mandating that or controls that to be reconsidered. And I know Marge Burton and others have met with NSU to express our displeasure with that whole process. So I hope I'll try to make sure I follow up on that for you again.
I did get an email from her several weeks ago, and I appreciate her work on that. And if you could update us, we'd appreciate it.
You bet.
Okay, do we have any other questions, comments? Okay. Thank you, Ms. Davis. Moving on to all business. Counselor Cherokee Watts has sponsored something here for discussion only. Jack Brown Center status update.
I was going to include my report. Also distributed, you'll see the renderings of our new Jack Brown Center. This is an aerial view. We're really excited. We currently have 20 beds for patients, and this will extend an additional 16 beds, so we'll have 36 beds. There'll be a separate boys' dorm from a girls' dorm, which is, we're excited about that. The second page kind of gives you an explanation of that. There'll be an art building, a cafeteria, and then this building here will be the administrative or intake area. Lots of private counseling areas. It's going to be beautiful. No, I told that wrong, I'm sorry. This is the administrative area. There's an old silo right here that will remain there, so it's really going to be beautiful. I'm really excited. We have the groundbreaking scheduled for April 26th. The month of April, I think the 25th is the 25th anniversary of the Jack Brown Center. So we wanted to schedule it close by and at the same time. And I believe the timeline on that is about a year, start to finish. Madam Chair?
Yes.
It may be impossible, but if you scheduled on the 25th, we're all here already for rules and unanimous.
I will see about that.
And I'll put it on my calendar still, but I just thought it would be an opportunity because I think this is an important facility to try. And Connie, that is that back of the property, or back of the existing campus.
The Marcoma campus, it is.
Okay, Marcoma, not, okay, that's where that'll be.
Yes.
And then, how many additional youth will we be able to serve in this facility? Like,
16. We have beds for 20 right now. This will be a total of 36 beds. I believe it's 20 male and 16 female.
Okay. And I'm sure we have data on the past. I've heard there's a huge demand, so, I know that this is it requires a lot of space, so it may be just that it's intensive, and even to almost double the capacity takes a lot of effort. But it seems like there's a huge demand again, so is that even going to meet any of our existing demand?
I think it will help tremendously. Darren Dry has been over this program since the inception, I believe, and he's been involved in every detail of this. And I'm going to take your time. I think Dr. Grimm had prepared a document to kind of explain historically where we started and where we're going with this facility. It says, it was increased to a 36-bed facility. We'll have an addition up to 36 employees. I think we have about 20 now. Does that sound right, Chet?
It says there's 28 in the deal and that we can do 56, we can handle services for 56 youth at this point.
Counting the outpatient, yes.
Okay, so it's still 20 inpatient and an additional 36 for outpatient.
No, there's 36 beds. That's in the second paragraph down there.
I'm reading as fast as I
I
can
know.
since you just.
I'm having to refresh my memory as well.
That 56 is, carries what our contract is with Indian Health Service. We get some funding from Indian Health Service to fund or to treat a minimum of 56 a year.
Thank you, to both of you. It's very helpful. So are we still coming in at about 5.5 million, or is this now with these drawings and plans, is that going to be estimated higher, or? Okay. Is this also HWH, or who's gonna actually do the construction and stuff again?
Seltzer Schaefer was the architect, and
That would be right now.
that's, you just told me that, yeah. Bid closes on the 22nd for construction. Of March.
Because there is so much interest around all the construction and stuff too, can you have purchasing or whoever's doing the bids to also send those over and such? So I assume that may be the description that we've been asking for in terms of the scope of work on the.
Okay.
I'm not sure I understood the question. Sarah, what are you looking for?
We're still discussing the infamous plan and the scope of work and like what goes into the facility, how large it is, if it's gotta be rooms geared to like an MRI machine or whatever that is. I assume that's in an RFP kind of package, that way you don't have to recreate anything, but we're looking for details still, so.
Okay.
And because there's been so many questions just around the facility in terms of like baby-friendly, drive-up pharmacies. Can we get the visual from the architect that shows the different rooms and such in a PDF?
Brian, can we get that?
I haven't been involved with that project. I would assume that
For Jack Brown? or
Any of these facilities.
Let me check to see where they are.
We have a lot of stuff going on, so.
The only ones that we haven't.
And I don't even know, Salisol may be.
Salisol just really for the old facility, the annex design is the one that you mentioned that's coming up March 26th. We don't have that kind of drawing for any of the facilities yet, except those two.
And in the last paragraph for Jack Brown, so we're gonna, the Cherokee Nation will loan Cherokee Nation Health Services the money and they get reimbursed for 250. How does that, at a possible rate of $250,000 starting in fiscal year 2015 to 2019? Is that how we're financing it?
Yes.
Jack Brown has been saving up money for the last several years to help pay for this. They had saved up about $3.5 million. The E&F committee a month or two ago, we moved $1.5 million over into that account. That would get us to the $5 million that we're estimating right now the construction bids to come in at. And what we're saying in that document is that then over the next couple of years, with their third-party revenue, Jack Brown would pay back that $1.5 million that Health Services moved over there.
Okay. Very good. Thank you.
Council Fisher-Hoff, you're next.
Okay, I just want to remark that we've got something we're looking at in April for this. In June, we're going to have a groundbreaking of Redbird, and both of these was on the master plan, and I really applaud Health for getting on this and coming up with this so quickly.
Thank you.
I really do appreciate it. And I looked at the stuff on the web. There is a lot of information out there on the Terra website for the bids on if you're wanting any information.
Okay, thank you. Oh, sorry. Madam Speaker?
I know there's been a request that that be done on the 25th for the groundbreaking for Jack Brown, but you already have scheduled the surgical technology program open house on that day, plus we have committee meetings. So I don't know what the preference of the rest of the council is, but I think the 26th would be more appropriate for this groundbreaking.
There's a lot going on that day.
I don't know how we would fit it in on the 25th, and I believe the packet on Jack Brown is out on the website for bid, so any council members that want to look at the packet or any information on Jack Brown can simply go to our website. I don't think you need to send that to us in an email, because we can readily get that ourselves by looking on the computers and the laptops that have been provided for this group, along with the internet that they can utilize. And the drive-up pharmacy, by the way, that was just for the future. I'm not asking you to do that tomorrow. That's just a future dream. And I thought if we got that little idea in, that maybe we could match that up with the hospital and whatever we are doing with the clinic later on. You guys are doing a tremendous job. Just keep up the work. Thank you all.
Okay, thank you. Our next item here is concerning Claremore Indian Hospital billing with Blue Cross and Blue Shield. And last month, I announced that I would appoint a work group to discuss this, which I did. And we met at great length, me and Joey Fishenhoff and Councilor Lay, and Mr. Bill Foster, our HR director, and our, what I call our insurance specialist, Amy Brill. I don't know her exact name. But we had a great discussion and went over all of this at great length. And I'm going to ask Councilor Lay to kind of condense it all down and tell what we came up with.
Yes, ma'am. Well, which this is Miss Watt's program, but what we talked about, and also let me give some background into when I first got here. George asked me, I think, out in the hallway, to check on why the Cherokee Nation doesn't allow our insurance to be applied at Claremore Hospital. And I said, I don't know, I'll find out. So I talked to Melissa Gower and somebody else in health at that time. Melissa was still here. And we sat down and talked probably 15, 20 minutes, and basically she told me that it was a financial situation, that it would probably raise the premiums on Cherokee Nation's healthcare cost and perhaps even back to the employees. And it's kind of difficult to say how much it would do. The meeting we had today went over with Mr. Foster and Amy, and they pretty much told us the same thing. And as much as I'd like to help Claremore, because a lot of my people are in the Claremore Hospital area, all of my people are. One of my first duties is to do the nation no harm. So I can't support this because I think it's going to raise our premiums for our employees and or the nation. Going to have to take it up. And that's my thoughts too.
Thank you. Councilor Watts?
Thank you. I apologize, I guess this is 500 emails I have not got to yet. The work group was scheduled, so we missed it, which I didn't remember, but it's in the emails, I'm sure, and I apologize for not being there. I know that in the Claremore Indian Hospital report, it looks like it was an average of, was it 300,000 or 600,000? Is George still here? 300,000 per year, just for the Claremore Indian Hospital impact in terms of the last 2 fiscal years. So I know this decision also had to be made at the same time that we took over Hastings, where we assumed those additional costs. And I don't know if those numbers have been presented on what that impacted for us to pay ourselves, essentially, through Cherokee Nation Health Services and our self-funded Blue Cross Blue Shield. But at the end of the day, it does impact Cherokee Nation citizens. And I still feel like we need to do this, and we can easily do it through the 5% dividend, which is later on the agenda. There's no reason why we still can't consider it and take it out of the dividend money that's not being spent. That's already allocated to health, so that we could further the facility that we don't own for Indian Health Service, but we still have an obligation to for 11 of 14 counties. Thank you, Madam Chair.
Well, we went over this in great length this morning, and Mr. Foster explained to us, he's here, he could answer for himself, but if we do it for one IHS facility, on advice of the attorney, we would have to do it for all, and there was potential out there of it. We couldn't see the benefit outweighing the harm that it would do, because it could possibly raise everybody's rates down at, that's on Blue Cross and Blue Shield. And, but I'm sure Mr. Foster would be happy to come up and answer any questions that anyone has about it, but it was the consensus of the committee this morning that we did not see to go forward with this. Yes.
I appreciate the findings of the committee, and I respectfully disagree when we have money left on the table to further one of our other health facilities in the Cherokee Nation. And I make a motion to change that to allow that our Blue Cross Blue Shield will be billed at Claremore Indian Hospital through Indian
Okay,
Health
we have a
Service.
motion. Somebody wants to second it?
Second.
Motion and second.
Roll call vote.
I have a question here.
Yes, go ahead. I'm sorry, you had your hand up.
Yeah, thank you. What we're getting ready to do here, you know, we've got a 5% program, I heard it mentioned by Ms. Watts. It more than makes up for, I believe, for the Cherokee Nation's portion for what somebody thinks that we may lose there. And here again, I'm not going to do the nation any harm. I can't support it from what I see so far. We've got a 5% program. It takes care of Cherokee people. There are 16 tribes, 17 tribes represented at Claremore. We hold about 50%. Some people tell me 60, some people tell me it's 45. I don't know exactly what it is. But when you talk about sequester and reduce funding and all kinds of stuff like this, we need to take care of the family first. That's my opinion.
Councilor Hoskins.
Thank you, Madam Chair. And just to echo what Councilor Lay said, I mean, Claremore Indian Hospital is a federal facility, and the federal government has long needed to step up for that facility. We've done some through the 5% already. We've taken some, the burden they've shoved off. Again, no offense to the people that are running that facility, but they're in a system that forces them to shove our people off, and we've picked them up. So we've made a substantial investment in Claremore already. How much more do we need to make, and at what cost? I mean, if we're not fully utilizing the 5%, I guarantee you if we did a comprehensive review of our healthcare needs, we'd find other ways to use some of that 5%. And first on that list is the Claremore Indian Hospital facility, for them to have extra money to do with what they will, I'll be surprised if that's first on the list. I bet there's other needs in my area through my clinic, in my area and other clinics. So I just question whether this is the best shifting of resources. So I join Councilor Lay. I can't support it, even though a lot of my folks up there use that. Thank you, Madam Chair.
Yes.
Well, let me make sure I understand this. This motion would this motion would force the tribe, through its insurance, to pay Claremore Indian Hospital for those clinic visits made by our employees. But then we turn around, and because of the increased cost, we're going to go most likely across the board and increase the insurance cost for all of our employees. At the same time, we've set aside this 5% to help all the Cherokees that use Claremore Indian Hospital. Now, folks, that doesn't make a whole lot of sense. Mr. Lay, Mr. Hoskins are both correct. We need to be careful about what we do on this vote, because what you're going to do is hurt all employees to help 17 tribes. We don't get the full benefit of using Claremore Indian Hospital, and it is a federal facility run with federal dollars, benefiting 17 tribes. If you leave everything the way it is now, our employees' insurance costs stay the same, our 5% kicks in to take care of our Cherokee people, and we leave the other 16 tribes to ask the government to assist them through it being a federal facility. So I cannot support this in any way, shape, or form. we're trying to do our best to help Claremore by setting aside this 5%. And I certainly don't, and never would support any of that 5% going to cover this. That was not what that 5% was intended for. I'm sorry that the other tribes maybe aren't getting everything that they need at Claremore, but we're trying to take care of our Cherokee people, and that 5% is Cherokee dollars, and it needs to stay with the Cherokees.
I know, our Attorney General is up, would like to make a comment, and then Councilor Craig.
I would respectfully suggest to the committee that the motion is out of order. The looking at the supporting documentation or the backup item for old business number 2, and there is none. The council would only be able to act in this instance through a resolution, which would be a statement of the will of this council to
Point of
suggest.
order, I believe the AG does not offer advice on this, and it's also contrary to what we did in rules concerning the clarification on the map. And I have an agenda item which makes it proper for it to be here.
I will tell you that the council will only act in this instance through a resolution or a legislative act, none of which is present before this committee. Now, if Ms. Callan Watts wants to sponsor such a resolution, then it would be appropriate for this body to consider. But until then, if you take a vote just on a pure motion, it would have no force and effect whatsoever and would be out of order. I just wanted to make that point clear.
Thank you.
Thank you.
Just point of clarification, I object to any vote being taken because we don't have a resolution in front of us to go by.
Councilor Craig.
Mr. Lane commented that we only should be treating Cherokee citizens. What percentage of Cherokee citizens do we treat at non-Cherokees do we treat at Hastings? Does anyone know?
Very few.
I have been told that Hastings was somewhere around 94% of us when we took it up, but I don't know that, so don't take that to back there.
I remember at Hawks, it was 97%.
So that was
we just taken
that
it
was
over.
the point you made, and I'm just trying to determine the federal facility. We only have one within our jurisdiction besides the facility.
She thought it was 97.
I remember it from when we took it over, when it was back to full council, it was 97%.
Yes.
In the health committee report every month, there is a breakdown by clinic of how many Cherokees are served versus total. You may reference that for purposes of this discussion.
Madam Chair, just on information, did the speaker make a point of order? Is that what I
He did, and there hasn't been a ruling on it yet.
Yes. I agree with what you said.
So no vote.
So there's no vote.
I may move to table the agenda item to next month.
We have she's moved that we move it to next month.
Table, so go straight to vote. Forget if she gets a second.
Somebody want to second it? Who seconded it?
Can't do it. Just can't. Motion table overrides.
Motion to table overrides everything else, so it's tabled to next month.
No, we have to take a vote on it.
Well, okay.
I'm sorry.
Right.
I believe you have to take a vote on it.
Okay. On the motion to table, everybody in favor, say aye.
Aye.
All opposed?
Aye.
We have to have roll call.
Jody Fishing-Hot?
A point of clarification before we take a vote. Yes vote would be to table, a no vote would be we discussed this to death, it's time to move on to something else.
No.
Meredith Fraley?
Motion table.
Motion to table.
Yes.
Janelle Fulbright?
No.
Don Garvin?
Yes.
Frankie Hargis?
No.
Chuck Hoskin Jr.?
No.
Connie Glory Jordan?
No.
Lee Keener?
Yes.
Dick Lay?
No.
Curtis Snow?
No.
David Thornton?
No.
David Walkenstick?
No.
Kara Cowan Watts?
Yes.
Bill Anglin?
Yes.
Jack Baker?
Yes.
Joe Byrd?
No.
Julia Coates?
Yes.
7 yes and 10 no.
We're not tabling it, so we need to move on. In new business, Counselor Lay, discussion and possible action, the 5% set aside for LA Law 2511.
Thank you, Madam Chairman, and if I attempt to bring probably Dr. Jones and Ms. Davis or Dr. Montgomery, one or all of those three, I need some clarification. That's what I'm shooting for. And I think that we discussed last time the dental dentures and the amount that we charge our folks if they don't qualify. I think there's been some movement on that, though, if you could help me through that. If there is.
We're talking about the denture program.
Yes, sir.
So we're looking at possibility of raising the cap on the income verification. Right now it's 185% of the federal poverty guidelines. We're looking at possibly raising it to 250%. We've been tracking the amount of denials since October. Of 50 denials, maybe 10% of them are due to income. Most of them are due to geographical location. So if we raise that cap, we may catch those, we may not. I don't know for sure. We don't write down how far outside those income guidelines they are.
And if we just simply make this I think it's $695, is that correct? That we charge?
Actually, it's about $740, and it's for an upper and $740 for a lower. So we're looking at about $1,400, $1,500 for the set.
But what's our charge? When they don't meet the income guidelines, what do we charge?
When they don't meet the income guidelines, if they take a contract out, they're able to get the denture made for that same price at one of our contractors.
Which is
around
$1,500?
Yeah, around $1,400, yeah.
Where's the $695 from?
There's different levels of partials and dentures. You may look at, that may be a different type of partial or something of that nature. There's about 10 different codes that fit into there.
So have you gone ahead and changed your policy then already, or what?
Not yet. We're still looking at, what the income, what's going to be the impact if we do that and find out where we're at. Because like for right now, with those guidelines, say at Hastings, for instance, we got $180,000 to spend. We've spent $140,000 of that already, and we're just in January. So
when you anticipate knowing which way you're going?
Well, I've asked all the clinics to send me their contract list and let me know where they're at on their contract money. Hastings and the Adair County and Cherokee County have spent the most. That seems to be where the biggest impact is. Some of the other outlying clinics, say Muskogee, because they're so close to the border, they don't spend their money nearly as fast. So it just depends on, each clinic has a different set of needs. So
could you, by next time health comes up, could you have that figured out?
Absolutely.
And I will table, or try to table this?
Yeah, absolutely.
Madam, I'd like to, everyone like to table this.
Second.
Okay, all in favor of tabling?
Just to let you know, we're looking at doing that in different, putting different regulations on different pots of money so we can kind of guide that a little more. So it's a pretty in-depth little deal to try to figure out exactly how to do it. So, thank you.
Okay, Mr. Lay has asked that this be tabled, and he's got a second on it, so all in favor of tabling till next month, let it be known by saying aye.
Aye.
All opposed?
Aye.
It's tabled. Next is Councilor Fishenhoff. Motion to withdraw? Second. No vote. Okay. Looks like we're ready to adjourn. I will entertain a motion for adjournment.
Second.
All in favor, let it be known by saying aye.
Aye.
We are adjourned.